Which of the following structures is located at the vertex of the Calvaria? A. Bregma. B. Lambda. C. Tyrion. D. Asterion. Answer: A. Bregma. Which suture connects the two parietal bones to the occipital bone? A. Coronal suture. B. Sagittal suture. C. Lambdoid suture. D. Squamous suture. Answer: C. Lambdoid suture. Which of the following describes the shape of the Calvaria in adults? A. Triangular. B. Oval. C. Dome-shaped. D. Flat. Answer: C. Dome-shaped. Which part of the Calvaria is most prone to fractures during traumatic injury? A. Frontal bone. B. Parietal bone. C. Temporal bone. D. Occipital bone. Answer: B. Parietal bone. What anatomical landmark is formed where the coronal suture and sagittal suture meet? A. Lambda. B. Bregma. C. Tyrion. D. Asterion. Answer: B. Bregma. Which of the following statements about the temporal bones is correct regarding the Calvaria? A. Temporal bones form the posterior part of the Calvaria. B. Temporal bones are located on either side of the skull. C. Temporal bones contribute significantly to the roof of the Calvaria. D. Temporal bones are fused with the occipital bone. Answer: B. Temporal bones are located on either side of the skull. Which of the following is true about the occipital bone in the Calvaria? A. It forms the anterior part of the Calvaria. B. It contributes to the floor of the cranial cavity. C. It forms the majority of the cranial base. D. It contributes to the posterior aspect of the Calvaria. Answer: D. It contributes to the posterior aspect of the Calvaria. The tyrion is the junction of which bones in the Calvaria? A. Frontal, parietal, temporal, and sphenoid bones. B. Frontal, parietal, occipital, and temporal bones. C. Parietal, temporal, maxilla, and zygomatic bones. D. Occipital, sphenoid, temporal, and frontal bones. Answer: A. Frontal, parietal, temporal, and sphenoid bones. Which of the following structures is found at the intersection of the coronal and lambdoid sutures? A. Asterion. B. Lambda. C. Bregma. D. Tyrion. Answer: B. Lambda. Which of the following is a primary function of the sutures of the Calvaria in infants? A. Allow for the expansion of the brain. B. Prevent bone movement. C. Enable bone formation. D. Enhance facial appearance. Answer: A. Allow for the expansion of the brain.